In all patients attending a primary eye care clinic for any reason, an examination of the optic discs should be performed. The detection of suspected or incidental disc changes is important. Examination of the optic discs and some of the retina can be made without pupillary dilation, but a much better and more extensive retinal view can be obtained after full dilation. The most basic instrument for the examination is the direct ophthalmoscope, and the model we recommend is the arc-light ophthalmoscope. This has the outstanding advantages of its lightweight, being solar or electronically powered, and the use of an LED source of white or blue light. The maximum light source for direct ophthalmoscopy is achieved by pressing the central button on the ophthalmoscope. The view from this ophthalmoscope is through the aperture on the top of the ophthalmoscope with the adjustable slide set to 0. This can be adjusted according to the refractive error of the patient. As with all examinations, it is important to ensure good hand hygiene before starting and also wear a mask. The examination is conducted in a semi-darkened room. The ophthalmoscope light is directed towards the pupil. This will show up as a red reflex, better if the pupil is dilated. This is helpful to detect any opacities in the media, such as a cataract, its spokes, particularly in an adult patient, or the absence of a reflex in a child with retinoblastoma. The patient is asked to look into the distance with the eyes slightly elevated. The right eye of the examiner examines the right eye of the patient, and the examiner's left eye used to examine the left eye of the patient. With permission, the examiner rests the hand, not holding the ophthalmoscope, on the patient's head to provide stability. The upper lid of the eye being examined can be elevated with the thumb of the same hand to provide good access to the globe. The discs will come into view almost immediately. If not, retinal vessels can be followed back to the disc. The most important features to be observed about the disc are its colour, the clarity of the edges, and the disc cup ratio. Here are some pictures to illustrate the discs. An undilated pupil can allow a reasonable view of the disc, but only limited observation of the posterior pole of the eye. This can only be seen in detail after the pupil is dilated, and they can be examined by asking the patient to look directly at the light. Examples of abnormalities at the posterior pole are shown in the following pictures. Retinal vessels can be followed from the disc into the 4 quadrants of the retina, asking the patient to move the eye to help bring the retina into the different quadrants. The retinal vessels and the retina between them can be scanned with the ophthalmoscope light to detect any abnormalities. The direct ophthalmoscope allows the examiner to gather much information about the health of the eyes. As ever, it is important to achieve the best environment for the examination and to proceed in a systematic manner.